My name is Erica Knoll, and I just had to get on here today because I got home from spending the morning at a doctor's office, and I had a presentation on ADHD while my daughter was in being evaluated for this. Now, we're doing the evaluation because she needs some help in school. Maybe she can get some intervention there. But I did not go to be hearing about drugs. So I have done my research. I have done my due diligence when it comes to research with ADHD. I have read books. I have searched and scoured for information on this. And as I was sitting there in the presentation, I started getting a little uncomfortable because this whole presentation that the doctors were giving me was funneling people to get medication. Now, I am not against medication per se. However, when it's a long-term medication that is simply covering up symptoms, I am against that. Now, from what I have read, from what I have researched, ADHD has a lot of different causes. It's a complicated issue, and there are things that parents can do to help their kids with this. There are things you can do in your diet. There are things you can do with supplements. There are things you can do with their screen time. There are things that you can do to help your child. Essential oils are one thing that you can do. Removing allergens is one thing you can do. Did you know that there's research out there that says that most kids that have ADHD have allergies? And when you put them on an ADHD medication, that does nothing to help their allergies. Absolutely nothing. It just covers up the symptoms. I am really passionate about this, okay? I tried to talk to the doctor. I raised my hand. I was very open and honest, and I gave research, and I suggested books. The doctor didn't want to have anything to do with it. Oh, that's my alarm. And I was rather disgusted that she wasn't even open to hearing that there were other options. There are other options. People need to know that there are other options. And guess what? There are doctors that are putting other options out there. If you've ever heard of Dr. Kenneth Bach, or if you haven't heard of him, look him up. He's got a phenomenal book out there called Healing the New Childhood Epidemics. It is amazing. And we in our family have done some of the things that he has suggested in there, and we are seeing improvement. And this isn't just covering up symptoms. This is actually taking care of the root problem so that the symptoms don't happen. Now, I have several kids that have issues with concentration or impulsivity, and so I've been working on this for a while, and we've removed several things out of our diets. And we have been working on getting tested for allergies and removing those allergens. And guess what? Miracle of miracles, it is working. And so to go and sit in this presentation and to have the doctor say, the best option is medication, the only option is medication, that is simply bull. And it makes me so upset because there are so many people out there that are just filing like sheep and just following this and hey, their kids are on medication. But there are kids out there that are getting addicted to their medications. There are kids out there that are having stunted growth. There are kids out there who are having psychosis and awful things happening to them because of their medication. There are kids that are actually dying because of medication. Look up Ritalin if you don't believe me on that one. It actually causes heart problems, heart attacks, things like that. And there are other medications that have other issues. Medications should never be the first answer to anything. It should be a last resort. There are other things you can do, and I am so passionate about this, and people have to know. Now, if you want to know any more information, please contact me personally, because our kids need us as parents to advocate for them. Medication may put a bandaid solution on. It may help the kid concentrate on their schoolwork or at home, but is that what you want? Because medication also has side effects, a whole long list of side effects. Is that what you want for your kid? Or do you want a solution that will actually take care of the problem at the root? Have you seen kids with dark circles under your eyes? Do your kids have dark circles under their eyes? I have a couple kids that have that. That is caused by allergies and food intolerances. And if you can find out what those are, and yeah, the testing is sometimes difficult to get and difficult to read, but the food intolerances especially, that is hard to diagnose. But when you can remove those things from their diet, the dark circles disappear. And guess what? The behavior issues disappear too. It's absolutely amazing. I want for my kids, for the root problem to be solved. What do you want for your kids?